Hey there. Today I'm going to do a little bit more of Q&A because I did get a very interesting question on one of the videos that I did, and something that I thought I'd just take a minute to reply to. So let me read the comment from the user quickly and then we can get into it. And it's from Testobear, and his comment is, "Brilliant and very helpful, thank you. Out of interest here, has anyone found testosterone helps with low confidence and anxiety? My natural test levels are very low, but being in the UK, the doctors are not keen to help, so instead prescribe me benzos. I am 40 years old and living a horrible life of anxiety." Okay, so it's a very good comment, and there's 2 points that I want to address here today. So let's get right into it. The first thing that I want to start with is the fact that he asks, has anyone found testosterone helps with low confidence and anxiety? The answer to that, from my personal experience, is absolutely. That is one of the main reasons that I initially sought out treatment in the first place, because I was constantly in my head, I had no drive, I was anxious about every little thing, almost to the point of neurosis. And I couldn't figure out why that was, It's like, I thought something was wrong with me. I thought I was going crazy, and I would have anxiety just doing things like going to the store to go do shopping and those types of little things. So there were other symptoms as well, physical symptoms and other conditions like low energy that were bothering me, but one of them was definitely anxiety, and along with that came low confidence. So for me, the minute I started the testosterone, all of that kind of evaporated and changed. Sure, I still have a few confidence issues here and there, but I mean, who doesn't? But in terms of anxiety and confidence overall, there was a huge improvement. Now, whether that's a direct result of the testosterone or not is debatable, because along with the testosterone, you get a renewed sense of energy, you get more energy, you're going to go to the gym more often, you're going to think more clearly, and therefore you're going to make decisions that impact your life in a more positive way. So maybe those changes that I implemented into my life as a result of starting the testosterone is what caused the anxiety and the confidence to diminish and improve. So, it's a difficult question, but I think, if you've tried all the other options like, taking care of yourself, going to the gym, eating healthy, and you still deal with these issues, I think, and especially if your testosterone is low, then I think getting treatment is definitely going to help towards that. But again, you don't know for certain. Every person's body is different, and I'm not a physician, so I can't say for sure. I think the fact that they're prescribing you benzos is ridiculous. This just shows you how the medical establishment works, and especially the UK government and the NHS, which I'll get to in a second. But they just prescribe you pills for any condition. They don't try to find the root cause of what's wrong with you, and you actually have to self-medicate in a way. You have to go investigate your own symptoms, do research on the internet, and try and build up your own idea of what is actually going on, because the doctors are just going to take a quick glance over you. They can be like, write a prescription here, take these pills, and hope for the best. And that's not the way to go. So to answer your question, I think you have a very strong case for testosterone being able to help your anxiety and your low confidence. Now, those things won't go away once you take testosterone, so don't think of it as a miracle cure, but definitely consider it as an option, especially if you have other symptoms to consider. And if you are able to get TRT treatment, see what happens, see if they do improve, and get back to us and let us know. All right, now for the second part of your question, and this one is quite a passionate topic for me because it's something I've had to deal with personally and dealt with all the frustrations. So let me just get to that. You asked, or you said that your natural test levels are very low, and being in the UK, the doctors are not keen to help. Okay, I can 100% understand what you're going on about, because I went through the same struggle that you did. Now, in order to get testosterone replacement therapy in the UK, you have to go through the NHS, or you can go through maybe a private clinic or sex clinic, but they're very difficult to find, and me personally to date have not found one that I could go to. So your only option is the NHS, okay? Now, to go to the NHS, who are they? Well, they're a government institute, right? They're funded by taxpayer money, and there's a lot of bureaucracy and red tape involved. And with most government institutions, they're going to try and do the best solution that's usually best for them and not necessarily for you. And testosterone replacement therapy in the UK is an expensive treatment, right? So they've got a vested interest to try and give you as many other alternatives as possible to actually giving you TRT, because it's going to work out cheaper for them in the long run. And considering, if you take a look at the UK population, and especially those on welfare and that don't do anything and that are jobless, you know, most of the time they spend drinking, not doing any physical activity, and just, you know, living a life of getting nowhere. And those kind of lifestyle habits are going to contribute to you having low testosterone. So there's a ton of people that probably could get testosterone replacement therapy if they ask for it, but just because of the lifestyle that they lead here in the UK. So the NHS is, you know, almost rightly so, has made it very difficult to get testosterone replacement therapy. Now, I know this personally because I've worked with them for about a year to try and get my testosterone therapy moved from where I was getting it in South Africa and Holland to here in the UK, and I had no luck. I'm not going to go into the details about that because I'm going to do a whole separate video on it, because it's a really lengthy and passionate topic for me. But let me just tell you up front that if your testosterone levels are not clinically low, and when I say clinically low, I mean by the UK NHS standards, and those are so low that you have to have the testosterone level of a dying 80-year-old man before they're even going to consider treating you. I mean, the range that you're looking at is so low that even those with low testosterone are probably not going to get prescribed it. You have to have very, very low testosterone in order for them to consider it. And I've experienced this firsthand. And even though, like in my case, I went to them and I told them I've got all these symptoms, especially after stopping testosterone replacement therapy so that I could get it here in the UK, even after I explained to them, I feel terrible. I feel I have no energy, I have no drive, you know, I'm feeling slightly depressed and anxious with a lot of anxiety. You know, I can definitely feel the difference from when I've come off the testosterone. They didn't want to hear anything about it. They work on a specific scale of numbers. You know, it's all bureaucracy and red tape. And if you do not fit within those numbers, you know, from experience, they don't want to listen to your case. They'll pretend to, and they'll go through all the motions of testing you for this and testing you for that and doing your blood work and that. But even though, you know, you might just be a few points over that minimum threshold of theirs, if you're not within the range, or should I say outside of what they consider the normal range, and you're not within the clinically low levels of testosterone that they classify and, you know, keep on record, then you're likely not going to get testosterone replacement therapy. And that sucks because, I mean, I'm 36 now, and 35, sorry, I'm 35 now and you're 40. And I know what you're going through. I mean, it's terrible as you start getting older, especially if you felt what it's like to have testosterone and then you have that taken away from you. So my suggestion to you is, if you can, try find a private clinic here in the UK. I have to travel to the UK, to the Netherlands to get my shot from my doctor there, or sometimes they send it here. Had no problem in South Africa, no problem in Holland, only in the UK, where it is government controlled, did I start having issues. So, I mean, that should probably say it all. So see if you can find a clinic for yourself here in the UK. And if you do, you're probably going to have a high chance of getting it because they don't have any vested interest out of it. You'll probably pay cash, which I suggest doing because it's worth it. I pay about 100 quid every 3 months for my shot, and you know, I would be willing to pay 500 quid a month if I had to for it, because that's how good it makes me feel and normal it makes me feel when I'm on it. So if you do find a clinic, let me know and get in touch, because I've looked here in the UK and I'm here in Devon, and I've struggled to find somewhere that I can get it, so much so that I'm still having to rely on getting it from the Netherlands. So I hope this helps you. I can definitely sympathize with your case and what you're going through, and based on what you've told me here in the message, I think number one, you should look at having a dose of testosterone just as a trial to see if that helps with the anxiety and confidence. Definitely get off those benzos if you can. And doctors not prescribing it in the UK, yeah, good luck. I went through that for a year. Went through all the motions, all the procedures that I had to go through, with the result being that, oh no, sorry, you're not within this clinical range, so we're not even going to bother. So yeah, I hope that helps. Bit of a side tangent there, but yeah, I've answered the question. And if anyone else has questions like these, I'll be glad to answer them. Just leave a comment in the comments below, or get in touch with me, and I will reply in a video blog like this. Till next time, bye bye.